everybody. Thanks so much for staying with us. With COVID vaccines now available to youngsters in the upcoming school year right around the corner, a lot of questions are being raised about the need to vaccinate kids and at what age. Joining us from Singing River Health System is pediatrician Dr. Andrea Logan. Dr. Logan, thanks so much for being with us. As I said, I think this is going to be a big story, especially with the upcoming school year. Do you have any qualms or concerns whatsoever in terms of safety, whether we're talking about 17-year-olds, 15-year-olds, 12-year-olds, or even younger?
So, no, the vaccine so far has proven to be very safe and extremely effective. So I feel very comfortable with the vaccine. My own child, my oldest is 10, so she's not old enough for the 12 and ups yet, but if she was, my child would get the vaccine. I feel comfortable with it.
Okay, but I think what's confusing a lot of people, there have been so many mixed messages. I was just reading an article, the FDA said just fine for 12-year-olds. We have the CDC saying so, but then just a few days ago, the World Health Organization came out and said children should not be vaccinated at the moment. Do you think that people are a little confused just simply by the fact that we're not getting consistent information by health officials?
Certainly, and you know, as much as the CDC and the Academy of Pediatrics, those are my organizations. But from the beginning of this pandemic, we've had a little bit of trouble with our leadership because it's of course, it's a new disease. Everything is new. We're all still learning. So I think some of the guidance not being 100% consistent all the time has certainly caused people to feel less confident than they ordinarily would be. And it's, of course, for us physicians, very frustrating because we want the public to feel comfortable being vaccinated because we want the pandemic to be gone and not come back.
Now, Singing River, they've been engaged in some outreach programs. I know with the Biloxi School District, and I think there's another school district coming up. Is it Pass Christian? I'm not sure. Pascagoula, maybe. How has the reaction been so far, just from what y'all have seen in working with these school districts?
It's mixed reactions, of course, like anything. What I will say to you, what I say to all my parents of 12 and ups with regard to the COVID vaccine, I think the biggest driver or motivator for parents getting their teens vaccinated is that if you're fully vaccinated, you don't have to quarantine if you get exposed to COVID. So, this past school year, certainly in our school district, there were many students who had to quarantine 2 and 3 different times from being exposed to the virus. So if the student is fully immunized, they don't have to quarantine anymore. And then the other, of course, benefit there is if your child plays sports or in the band. Last year we had a lot of situations where, for example, the Ocean Springs High School band whole band had to quarantine for 2 weeks. The whole cheer team had to quarantine for 2 weeks. So if a lot of the athletes and students who are involved in these activities would be vaccinated, then those particular students don't have to quarantine if they're exposed. And I think that makes parents, maybe a little bit more interested in the vaccine.
Now, I hate to drag you into a policy question, and this is varying all around the country, whether or not vaccinations will be required to go back to school. Governor Reeves told me just a few weeks ago that in Mississippi, that's a big, clear no. That's not going to happen. What are you hearing? And again, I hate to bring you into an issue of policy, but what are you hearing about that?
So I personally would not be in favor of mandating the vaccine just because, it's pretty new and I can understand, whereas I'm not hesitant at all. I tell people I got my vaccine the very first day it became available to healthcare workers. Like day 1 in December, I was there. But I understand that people are still nervous. It's a new vaccine. So I would personally not be in favor of mandating it for that reason. But I think certainly I would encourage, I tell patients, I suggest that you consider the vaccine for your 12 and up. I think it's a good idea, but that wouldn't be my personal approach.
And we talked about this, I remember last year when we were really at the height of the pandemic and schools were reopening, whether or not, really what is the danger? Is the danger children contracting possibly COVID in the school environment? Is it them bringing COVID to school from home or whatever social activities they're involved in? I mean, where is the danger there, do you think?
Well, I think at the time we weren't real sure when we were trying to get back to school, but it seems like in retrospect that, well, it is true in retrospect that the virus is mostly spread in the home or among social gatherings with close contacts. Less so, we really didn't have very much spread even in restaurant type settings. We had I think, no spread of the virus in the school setting. Even if we relax the schools back to, I know we hopefully won't be in full, with the full-blown masking and distancing coming up this upcoming year, because of course it's detrimental to do that forever for kids. But the virus hasn't seemed to spread that much around in school. I think the biggest concern, because the virus is of course worse for folks as they get older, would be children bringing it to school and giving the virus to their teachers, or children contracting the virus at school and sharing it with their older family members. Now, we're learning, as we continue to learn more about this virus, we're still not sure what the long-term repercussions are of the virus. So no, it's not that it's totally benign for your 11-year-old to have COVID, but certainly it is more severe for older folks.
Okay, we have less than a minute left. And you said you were vaccinated. I was vaccinated. Well, I didn't have any qualms about it. But do you think it's a legitimate concern? Because people say to me all the time, we're under this emergency use authorization. Technically, it has not been officially approved by the FDA. Do you think that's an issue that people should even think about?
Yeah. So, and I briefly reviewed the process for the EUA versus a CDC approval. And the way I explain it to people is, it's not that they didn't do the vigorous testing. It's that, any kind of government bureaucracy or any kind of approval, you have to submit to be approved, and then you have to wait your turn, and then you have to be approved for the next step of testing, and then you do the testing, and then you have to wait for approval again. So with emergency use authorization, basically it's that the vaccine was able to cut in line so that we didn't have to wait for every single step of the approval, so they could go ahead. And then the other thing is they could go ahead and begin manufacturing the vaccine in big quantities before they finished all the testing. The testing still had to be done. There were still all the phases of the trials. I also think it was wise to roll the vaccine out first to healthcare workers, because it's almost like we were another arm of the test when we all got vaccinated in December and January. So we were. No, I'm not at all have any qualms about the emergency use authorization.
All righty, Dr. Andrea Logan, I know you're busy. We appreciate you taking time out and being with us here on WLOX News this week. Thanks so much. A South Mississippi man